Good morning. For the assignment of, let's see, what's the assignment? For foot and ankle evaluation reflection, I had a client come in who was describing pain in her, like, a superior aspect of her lateral malleolus, and she could feel that pressure, like this pressure kind of travel all the way up until right below the knee on that lateral side. And so we did an evaluation on her. So for question one, was my evaluation comprehensive? Why or why not? Yes, I feel like I hit some important landmarks when I went through and started testing for range of motion and manual muscle testing just to see if I could get her symptoms to flare like she was discussing. This patient was also a wrestler, so I did do sorry. I did do nerve testing as for signs of like Tinel sign due to uncertain impingement. Vanessa was also with me, so she also kind of talked me through on some other things since this was her first case of seeing nerve issues. So I did the Tinel sign on her, and then her active range of motion was normal. There was some pain in her eversion, but mostly we came to the conclusion that we think that it was just a pinched nerve of one of the deeper superficial perineal nerves. Did my palpation inspection objective measurements lead to a confident diagnosis? My first diagnosis I came about was an impingement of a nerve. So I think I did a good job with identifying what the potential diagnosis could be. Other diagnoses that me and Vanessa talked about afterwards was compartment syndrome because of this pressure buildup that she would feel after working out. We don't necessarily think that's it because it didn't hit any of the 6 Ps. However, we did talk about how that's going to be something that we keep in the back of our mind while we continue to work with her. So, did I incorporate evidence into my evaluation? Why or why not? So I used the Tinel sign as a primary test. I also used Ottawa ankle rules because suspicion of potential fracture. So I also used the compression test also, but they were both negative. But the pain was on the medial to the lateral malleolus, so I was just checking to make sure that there wasn't any potential fractures that she was playing on or to elicit some of that pain. What did I do well? Discuss 2 areas. Well, I feel like I did really well identifying the MOI. I feel pretty good about that and using the manual muscle test to help identify the issues presented. With this being my first nerve impingement evaluation, I think I could have done a better job with using other areas, like other special testing when I did that. I also had Vanessa walking me through, so I could have done a special test and just missed it after I got done with my initial evaluation, and then she came through and did the other. And I feel like those areas of determining the initial MOI of like the area that is, the chief's complaint, what's going on. I feel like I'm pretty good with like isolating what that could be and then potentially like breaking off from what else it could be. And another thing that I feel like I did a good job with was being able to just talk to my patient and just kind of get the information out of her for what I needed out of her. But again, I think another thing that I can improve on was, would be to just keep practicing on using these special tests that we do in class, and not just isolating it to one special test, but maybe trying to branch off and use several too in my examination, just to make sure that the positive that we find in there is consistent. So